Hello. Who is here with me? So some of you come in live and then some watch this recorded. So I like to see who's here live with me. If you could let me know so I can know who's here. And then especially if there's any specific issues you have today, anything you'd like to focus on, please let me know. So who's here? Say hello, hello. Want to make sure there are no troubles. Making sure that the email went out with the link. Make sure you were able to get that. All right. Who's there? So today I definitely have something planned. So I will move and proceed forward as planned, whether some of you were able to show up or not. I think what happened is, I don't know if the link went out today, but I'm here and we are going to practice yoga. All right. Well, let's do it. Let's do it. So today we are practicing 12 poses versus osteoporosis. This is an ongoing study that Dr. Lauren Fishman, he's a physiatrist, which means a doctor of physical medicine. And I started my training with him in about 2013, really learning about osteoporosis and what the disease of osteoporosis was. Maybe I'd heard of the word before, but not really thinking too much about it. I learned so much from him. I learned so much about the relationship between muscles and bones. And I learned how to tailor the practice of yoga specifically to important areas that matter when it comes to our bone health. That being the whole hip complex pelvic area, the spine, posture, balance, really important when it comes to bone health. So there are 12 postures in particular that are chosen with an intention to strengthen or lengthen our body in a way that will be supportive of our bone health, for fall and fracture prevention, for balance, and for strength. So get your props ready that we'll use. You need a mat and a block, a strap, and a blanket. And then today we're going to begin in a chair, so go ahead and grab a chair as well. And let's get ready to arrive. Yoga is a practice of mind and body. The word yoga means to yoke or to union. So we're coming to the present moment with all parts of ourselves, our mind, our body, and our soul, all here in this right now moment. So get your chair. If you'd like to put a blanket underneath your feet, or if your feet don't touch the ground, you could elevate your feet on something. And then come forward in the chair so your back is not touching, and then slide one buttock at a time back so that the low back touches the chair and you are in a nice aligned position in your spine. Elbows are underneath your shoulders and then palms are up on the thighs. This is a relaxation position for the shoulders. So if you have shoulder issues, you may notice that this feels nice and relaxing. And then you could let your back touch the chair, or when you have your pelvis all the way back, you might find that your spinal alignment actually puts you in a position that you don't even need to rest up against the chair. And then close your eyes and arrive right here, right now. So at first, when the eyes are closed, other senses may be heightened. So noticing what you notice around you. And start to bring your awareness to your breath, to your nostrils. And feel the breath coming in. Feel the breath going out. And let your awareness be at the nostrils, feeling the coolness of the breath coming into the body. Outside temperature is cooler than the inside temperature, so feel the coolness, even flaring the nostrils. Slow your breath down. And then bring your breath to your heart. Breathe to your heart. Breathing to the chest, feel the chest expand. Feel the forward movement of your chest. Feel the sides moving. And then breathe in and breathe back behind your heart. Breathe down to the lower ribs, down to the belly. And feel the stretch that happens inside your body. Breathing to the lower ribs. Breathing to the belly. Breathe to the front of the lower ribs. Feel them expand forward. Now breathe to the sides of the ribs. Feel them expand wide. Breathe to the back of the lower ribs. In and back. And now as you breathe in and breathe down to the seat. Feel that pressure in the lower belly area. Now notice that as you breathe in and down to the seat, there's an upward movement. So as you breathe in and breathe down to your seat, bring your awareness right to where the belly button is and feel that as you breathe in and the belly pressure rises, there's a lift, a rebounding lift that comes into the spine right behind the belly button. See if you could feel that, notice that. You breathe in and down to the seat. As your belly expands, the pressure increases. There's a rebounding lift upwards in the spine right by the belly button area. Now as you breathe in, feel all the ranges of motion, forward, backward, side to side, up and down. As you breathe down to your seat. And then finish the breath you're on. Take 3 more long, slow, deep breaths down to your seat, feeling the forward, backward, side to side, and top to bottom movement inside your body. Rib cage expanding. Finishing your last breath. Bring awareness to your hands. Rub the hands together. Rub them quickly so you feel the heat generating in the palms. And then cover your eyes and gently allow the eyes to blink open. So when we do breath work in a seated position, we allow the lungs to expand in all 6 ranges of motion: forward, backward, side to side, and top to bottom. So bring yourself forward in the chair so you're not at the back of the chair. Let's move our spine in the 6 ranges of motion. So I'm going to turn to the side here. So take your pelvis is like a basin full, imagine it's full of water. So just the pelvis is going to tilt forward and backwards, forward and backwards, forward and backwards. So take your hands on your thighs, press down so you can stay nice and tall in your body, and start to tilt your pelvis back. You could feel the sits bones. You're on the chair, so feel the sits bones rocking back and forth. Now, the upper torso doesn't move. You're not going forward and backwards with the torso. See if you could isolate just the pelvis. You could feel like you're lifting the pubic bone up towards the lower ribs when you tilt your pelvis back, activating the core, and then soften the belly. Bring yourself forward, back and forth in your pelvis, back and forth. So that's flexion and extension in the lower back. Let's move a little bigger in this position. Take your hands, slide your hands back, elbows go back behind your body, throat opens, look across the wall, look up. This is extension or a back bend. We need more of this in our bodies. This happens on the inhale. On the exhale, bring your hands forward, tilt your pelvis back, bring flexion into the lumbar spine, and then stop there. We do not want to flex our spine with osteoporosis. So you want to come into the extension, the inhale, the back bend, and then tilt the pelvis back, keep your spine nice and long when you come into flexion, and only bring that into the lumbar spine. Inhale forward, exhale into spinal flexion in the lumbar spine, stretching the lower back muscles. Inhale and exhale. And then one more. Bring yourself back. So that's one thing to be cautious of when it comes to osteoporosis is no spinal flexion. You want to maintain the safe spinal space. So take your hand underneath your heart, take your other hand at your belly. This space right here has 7 vertebrae. These are the most commonly fractured with osteoporosis. So call this your safe spinal space, right below the heart, right at the belly button. And you want to maintain this physical distance here in everything you do. So take your legs a little wide. When you bend forward, you maintain that space. That means you're bending at your hip joint. This is practicing safe bending when it comes to our bone health. Learning how to bend in the hips so it looks like this. You're bending forward, the spine stays long. We're not letting this space get closer. If I flex my spine, my hands come closer to each other. You want your hands to stay this far apart from each other when you bend. And this is how we safely bend when we're practicing yoga and when we're moving throughout our day. So learning here on the mat how to stay safe, how to move. Let your body feel those safe functional movements when you're practicing yoga so you take it off the mat into life. And so we want to make sure that the hands don't come closer together physically because that will indicate that you're flexing or bending your spine. So flexion and extension are 2 of the movements in the spine. Let's do lateral. So take your hand up towards the sky and then the other hand up. Try to keep the arm alongside your ear. Make sure you're not rounding the spine here forward. Keep that safe spinal space. The distance from the heart to the belly button stays lengthened. You don't want your hand to go in front. We're not trying to get far over. You want to laterally bend your spine, stretching the muscles along the side of the body, stretching the spine itself, lubricating the joints of the spine so that when we do the postures and we pull on the vertebra with the muscles, we create stronger muscles and stronger bones. Lateral flexion. Then bring your hand behind your ear. Keep your elbow up towards the sky. If you do have shoulder issues, this may be a more preferred movement pattern for your body. Keep your arm to the side. One more each direction. And then bring yourself back to center. That's side bending. Now we're going to come into rotation. And spinal rotation can be one of the best ways to create stimulation in the spine. And we need to be careful. We need to maintain that safe spinal space without collapsing. Keep this distance. If you had a ruler, whatever this is, however many inches this is, you want that space to be there without the hands getting closer. And of course, sometimes we're needing to bend our spine when we're reaching for something, we're getting dressed, gardening. So just being very cautious that you put most of that forward movement into your hip joint and not into your spine. Let's bring in some rotation, beginning with the head. Elbows are underneath your shoulders to keep your spine safe. And then look up and look back. So look with your head, inhale to look up and look back. Go as far as your body will let you go. Feel this movement in your body. And now I want you to let your shoulders go a little more. Let one hand slide forward, the other hand slides back, the elbow slides back. That's going to keep your spine nice and lengthened. And then we go the other way. So one hand comes forward and one elbow goes back. Inhale into the stretch. Exhale back to center. And you'll feel that rotation. The rotational muscles are trunk muscles that are attached to the top of your pelvic bone and the bottom of your rib cage. So that's where 80% of the rotation takes place, right where the middle spine and lower spine meet. So make sure this feels appropriate for you and your body. And if you want to let your knee go forward and your hip comes back, you may be able to go a little farther. You may be able to look all the way behind you. So for some of you, that might be something that you're able to do. And for others, it might not. Do what's appropriate for you and your body. The goal is to keep movement in your body and to use your muscles every single day, because the stronger your muscles are, the stronger your bones will be. And then bring yourself back to center. So 6 movements of the spine. Flexion. Flexion is forward folding. We won't want that in lumbar spine. We don't want that in the thoracic spine. Lateral or side bending, and then rotation. Those are the 6 movements of the spine. Let's take the arms to the side. Inhale to open. Look across the room about 2/3 of the way up the wall, and then exhale to hug yourself. Inhale and exhale. You can start to let your arms go a little higher if your shoulders will let you. If you're nursing shoulder issues, then keep your arms a little lower. If you'd like, you can let your head go a little higher. This is going to tilt the head back. It's going to give some work for the upper postural muscles. The upper back and neck muscles are going to be activated. Shoulders are working, chest muscles. So working a lot of those upper body posture muscles, those powerful pecs. Pectorals, chest muscles. And then bring yourself open here. Stay here for a breath. Push your head back. Chin is parallel towards the ground. And then little pulses with your hands back. Push your shoulders away from your ears. Make sure you're not wearing shoulder earrings. Push the shoulders down. Push the hands back. And then the gaze is up, either where the wall and the ceiling meets or straight in front of you. Take one more breath. And then bring yourself down. Take a break. Feel that tension working and strengthening the upper body muscles. We are weight bearing when we practice yoga. When you hold your arms up, all the weight of your arms with the pressure of gravity pushing down is weight bearing. So you're gonna feel that in your muscles. Take your arms out to the side and let's make the shape of a letter W and a Y. So we go into the shape of the W and you inhale into a Y. W and a Y. You inhale into the Y, exhale into the W. Try to push your arms back so that they're as close to the side of your body as possible. One more. And then bring yourself down. Take your hands down alongside your body. You're gonna inhale up, let your gaze go up. Turn your hands down, lengthen the back of your neck, tuck your chin towards your chest. Inhale and exhale. Now warming up that cervical spine, the neck spine. You inhale up. This is extension in back bend in the cervical spine or the neck spine. Now you tuck your chin towards your chest as you come down. Maintain that safe spinal space. Inhale and exhale. Bring your hands onto your thighs. So in these movements, really stretch your body. Really reach away from yourself when you're doing this to work as many muscles as possible. Take your fingers, bring your fingers onto your shoulders. And then inhale up, exhale down. Inhale and exhale. Inhale up, exhale down, chin to chest, elbows down, elbows forward, elbows up, out, back, down, and around. Chin to chest, elbows up, out, back, down, and around. Chin to chest. When the elbows come down, you inhale up. You could close your eyes and feel this. One more. And then bring yourself down. We're going to move on to start to warm up our legs. So lift your leg up and out to the side and up and back. Up and out, up and back. So be at the front edge of the chair, warming up the hip joint. Try to keep your torso forward and only let the leg move in the socket. So don't let your whole body go with this. Let your leg lift up and out. And if lifting up is too intense, you could tap your foot out to the side. Warming up the hip joint, warming up hip flexors, the muscles of the legs, or high. And then bring yourself back to center. Sit all the way back in the chair, so take your buttocks one at a time all the way back. And then bring one leg up, point the foot strongly, feel the stretch on the front of the foot. If you push that thigh down into the chair, you'll be able to sit nice and tall and feel that work of the leg muscles. Point and flex. Point, feel the top of your foot, that's your inhale, and flex through the heel, that's the exhale. Feel the back, the posterior muscle group. It's going to stretch plantar fascia, it's going to stretch Achilles, your calf. Point and flex. We need limber ankles for fall and fracture prevention. And then circles in one direction. Starting to feel the heat, the quadricep muscles, so the hip flexors here are getting work. And then go in the other direction. Keep your legs stationary, only the ankle joint. You're articulating the ankle. Imagine your toe has a Sharpie marker and you're drawing a very big circle. And then lift that leg up, flexed, push the top thigh down, lift your heart, lengthen your spine, and then go ahead and release. Feeling that tension in that muscle group there. Bring your other leg up and you point and flex. Pay attention to how you're sitting in your torso. Do not slouch, maintain that safe spinal space the whole time. Point and flex. Point and flex. Push that thigh down into the chair, the back of the thigh down. It'll help you sit up taller, help you maintain that better postural position. And training your body that this is where we bend, not letting it happen in the spine. So really strengthening those parts of us that make us or give us that really good safe functional movement pattern in our bodies, point and flex. Now the circles, pushing the thigh down into the chair, feeling the heat develop in the quadriceps, slow circles, legs stay straight, you're articulating your ankle joint. In one direction and then in the other. And then go ahead, flex, push down with that thigh, and then release. So weight bearing is when we're lifting our body against gravity. And that's how we create stronger muscles. So we're gonna come to standing. You can leave your chair where it is, just wanna show you from the side. You're gonna come to the very front of your chair and bring your feet closer to your chair. Bring your legs together. And then you're gonna bring your arms forward, push your feet into the floor, lift up and down, and pause. Up and down. So not too much momentum here. Try to activate the leg muscles, push the heels into the floor. And then if this is a little challenge for you, you could take your hands on your thighs, push the heel of the hands into the legs and the heels of the feet into the floor, or hands could be forward. One more. Go slow as you bring yourself up to standing. So let's warm up the feet for the standing postures. Flip the toes under. Toenails touch the ground. Try to put the foot in front of you. If balance is an issue and you need the chair, take the chair next to you and tap it. Don't hold on to it, tap it. So you know that it's there and you're waking up the communication of balance in your body. Keeping that active for fall prevention, keeping our balance, our musculoskeletal communication, the nerves, the muscles, push the foot forward. And now bend the toes, lifting the heel up towards the sky. You want all the toes to bend, so make sure that the pinky is bending, you're really coming onto the ball of the foot. And then if you can, lift both heels up at the same time. Look forward at something. It's going to bring a little balance into your awareness. And then come up and stay up if you can. Challenging yourself appropriately. If you need the chair, and then bring yourself down. A little backwards in the heels, a little forward in the toes. Back in the heels, forward in the toes. Bring your weight forward, bring your weight back. And then one more. Let's do the side, the ankles. So rolling onto the pinky toe edges of your feet. Feel the ankle stretch, the side of your leg stretch here. So bringing your arches up away from the ground. You're on the pinky edge. You could come in and out of this, or you could completely stay in this. See what feels appropriate for you. And then go ahead, come out. So we're going to come into the tree posture. This is a balance posture. So we could come into a traditional tree, or you could try to do the Karate Kid instead, where the foot is forward. Make sure that the foot is under the knee. Don't have the foot back here or the knee back here. Lifting the foot forward, you could start with the toes on the ground. So whatever single leg balance you'd like to do. Bringing now in the 12 poses versus osteoporosis, it's the tree posture. So have the chair next to you, and you're going to tap on it if you need it or not. Lift your toes, spread your toes, take your hands down alongside your body. From here, push your body weight towards one side, bend the opposite knee, and bring that foot on your leg. Make sure the heel is not pressing in the knee joint. So keeping it down low, whether your foot is down low or up higher on the leg, it's the same amount of pressure in the pelvis. Make sure you maintain your safe spinal space. Don't crunch your spine or flex your spine to try to reach your leg to bring it up, because it's no different having the leg higher than lower. So come into tree pose. You can bring your arms into any position you'd like. If you need a challenge, if you're strong in your balance, you could look around with your eyes or move your hands, challenge your feet and your ankle, challenge that hip to balance. Wherever you are, it's your practice. And so challenging yourself every day is how you're going to keep your muscles and your bones strong. Take one more breath. Bring your knee forward. Bring your feet on the ground. If you need the chair, take the chair to the other side. Bring your feet close together, not too far. Pick up your toes, spread your toes, hands down alongside your body. Push your body weight to the other side. Bend the knee and bring the foot up. Or come into Karate Kid, whatever you're going to do in your tree pose. The challenges to add, if you're feeling really confident, is to start moving your head around, looking around in different directions. That's going to be a challenge. Or straight up above you. And then if you're really confident, you could close an eye or two, taking away the visual, which can be a big challenge. Of course, making it appropriate. And if you need the chair, try tapping versus holding on. Take one more breath. And then bring yourself out. Shake your legs. Let's come into triangle. So triangle with the chair. I'd like to guide you through the triangle here. So triangle, we want to bend at the hip joint, not in the spine. So let's all do the left side together. So set yourself up so you could do your left side with me. Take your legs really nice and wide, the wider the better. And then press the left heel into the floor. Keep that left leg straight as you swivel on that left heel, turning the left toes under the chair. Make sure you don't go like this to try to get into it. Pull your toes towards you, your left toes, and then turn into what's called external joint rotation here. Pick up your right heel and move your right heel away. Shoulders are forward, up, back, and they're down. Take your left hand on your thigh and then bring your left hand at your waist, right in between the lower ribs and the top of your pelvis. This space needs to stay nice and long. Spine is nice and long. Push the pelvis away from you as you bend at your hip joint, maintaining the space in your spine. Don't shorten the waist in order to bring yourself lower. Lower is not better. You want to be lateral in that hip joint. And then bring your hand to the top of the chair, other hand in the sky. Or if you could, keep your spine long, keep the space between the lower rib and the pelvis nice and lengthened, you could come down a little farther. Squeeze your buttocks, pull your tailbone down to the back right heel. Press the pinky toe edge of the right foot into the floor, pinky toe edge of the left foot into the floor. Grab the floor with the toes. Push your pelvis away, lengthen your spine, and then rotate the spine up towards the sky. You should be between, if you could be between two sheets of glass. So don't let your tushy be pressing too far behind you or your chest forward. And that usually happens if we bend our spine and not our hip. Push the pelvis away, lengthen your spine, hard up towards the sky. Press into your feet, the pinky toe edges, push the right foot to the right and the left foot to the left. Take one more breath. And then you're going to bring yourself up and out. Bring the chair to the other side. So the intention is to create a lot of stimulation in that hip complex, not to get down lower and bend our spine in the process. Take your feet wide. Pull the right toes up, you're on the right heel, and then turn the right foot to the right, left heel up and back. Shoulders are forward, up, back, and down. Take the right hand in between the lower ribs and the hips, or the top of the pelvis, lower ribs. Push the pelvis away, the bend is in the hip joint. And then pressing down with your feet into the ground, the back pinky toe edge. Come into triangle on this side. If you could go lower to the chair by keeping your spine nice and long, you push away from the chair. You're not grabbing on or holding, you're pushing away so you can push your pelvis away, bend at your hip joint, get as tall as you can in your spine. Squeeze your buttocks, pull your tailbone down towards that back heel. Nice and long in your body. And then long spine, rotate up towards the sky. That adds some stimulation to the lumbar spine with some rotation in the body. Push the pinky toe edges into the floor. Grab the floor with the toes. Deep breaths. Feel this in your body. Take one more breath. Keep your legs nice and straight, long torso as you bring yourself up and out. And then shake your legs. So we're going to come into warrior two and side angle. If you'd like to use the chair, putting the chair in front of you can get a wider stance. If you do use the chair, two legs need to be on the chair, on the mat, so the chair doesn't slide. And then come into the wide stance. Going to the left side first. So lift the left toes, turn the left foot to the left, lift the right heels away. Let's start to warm up the knee, warm up the hip here. So push down on the chair, push away from the right foot as you bend the left hip joint and the left knee and come out. Push the left knee to the left, push away from the right foot. Your hands can be on the chair. Make sure your torso doesn't go forward. You want it to be the bend here. Your body will go straight down because you're bending your hip. And that's what we want to do, is create a lot of stimulation in that hip. Hands on the chair, push away from the right foot, lower down into the deepest angle you can in your knee and your hip. Push your left leg to the left, grab the floor with the feet. Shoulders are forward, up, back, and down, and then lift your arms up into the warrior two. Look over the front left middle finger. Keep pushing the left knee to the left, the right knee to the right, pinky toe edges, toes. Squeeze the buttocks and pull your tailbone down to minimize that lower lumbar curve. Push the shoulders away from the ears, slide the shoulder blades towards each other. Lengthen out your fingers, lift your heart, lengthen your spine. Push away from the right. If you could go deeper, go deeper. Squeeze the buttocks, pull the tailbone down, push away from the ground and get as tall as you can in your torso. Take one more breath. And then bring yourself up and out. Keep your feet nice and wide. Toes are forward. Lift the right toes up. Swivel on the right heel, left heel up and back. Take your hands on the chair. As you press away from the left, if you push away from the left, bend the right hip, bend the right knee, push the right knee to the right as you warm up the hip and the knee. And then next time, come down. Hands on the chair, push away from the left pinky toe edge. Toes are in the ground. Bring yourself as deep as you can. Push the right knee to the right. Shoulders are forward, up, back, and they're down. And bring your arms up. And then start refining your posture and your alignment. Pinky toe edges press in. Toes press in. Push the shoulders away from the ears. Slide the shoulder blades towards each other. Be as tall as you can in your spine here. If you could go deeper, go deeper. Keep pushing that right knee to the right. Squeeze the buttocks and pull the tailbone down so you protect your lumbar spine here. Pushing, lengthening, lengthen out your fingers. Push your shoulders away from the ears. Slide the shoulder blades towards each other. Press into the heel, the right heel, and feel that action in the back of your body. Take one more breath. And then bring yourself up and out. And then noticing with all that work in the feet, lots of ankle and footwork here. And for fall and fracture prevention, we need strong ankles, we need strong feet. We need that communication neuromuscularly throughout our body for balance. So the next posture we're going to come into is side angle. You could use the chair if you would like, And then if you're able to go pretty deep and load down into your leg muscles, into your joints, you could try this with a block. So the chair could stay there if you need, or you could put it off to the side. So you choose what's appropriate for you. It's your practice. You could be near a wall as well if you need that. So coming into the wide stance, we're going to go to the left, take your block if you're using a block, then bend the hip joint, keeping the safe spinal space to place the block on the left. Toes are forward, lift your left toes, turn your left leg, keep that leg straight to the left foot to the left, right heel back. Then you're going to bend the left knee, push away from the right side. Your body goes straight down into the hip, into the knee. If when you come down, your foot is closer to your body than your knee, if this is you and your knee is over your foot, walk the foot forward. Press away from the right, bend into the left, shoulders are forward, up, back, and down. Come into the warrior two, and from here, lengthen your side waist, and then bring your hand on to your thigh, keeping that length in the waist here. Do not bring the lower left ribs closer to the pelvis. Be as far away, be as long as you can be on your side body. Feet active, toes, pinky toe edges. You could bring your hand onto the inside of your leg, or if you could go deeper and keep your waist nice and long, you could come down onto the block. Push that knee away from you, squeeze the buttocks, pull the tailbone down towards that back right heel. Long waist, long left waist. Keep your feet active, and then turn your heart up towards the sky. Take one more breath. Bring yourself up and out. Go to the other side. Toes are forward. Lift the right toes. Swivel. Left heel. Active feet. Your toes, the pinky toe edges, the heels. Shoulders are forward, up, back, and down. Pressing away from the opposite side. So press the left away to bend the right, pushing the right knee to the side. Coming down into your deepest place for you, and then bring your arms up into a warrior two. From here, long with your waist, reach up into the side, and then bring your hand onto your thigh. This is a place to be. Palm is up, maintaining that length in your waist, bending in the hip joint. If you could come onto the inner thigh, try that, or to the block. Push away from the floor. Push away with the left foot, grabbing active toes, squeeze the buttocks, and pull that tailbone down towards that back heel, saving and protecting the lower lumbar spine. Long, long, long spine, and then rotate the heart up towards the sky. Push your heels, pinky toe edges, toes. Take one more breath. Bring yourself back up to warrior two and then out. Come to rest in mountain pose, posture of alignment. Lift the toes up, hands down alongside your body. Close your mouth, breathe in through your nose. Feel your lungs moving in all 6 ranges of motion. Forward, backward, side to side, top to bottom. Lower your heart rate with breath. Take one more breath. So we're going to do the twisted triangle. Like to do this one with a chair. Could use a block for those of you that have a stronger practice. A lot of range of motion in your body. Bending your hips when you bend down. Block can go on the side of the chair if you're going to come down with the block. So when we do our foot position, the closer the feet are to a tightrope versus railroad tracks, that determines what's happening with the pelvis and for balance. So if you have issues with balance, having your feet a little wider might make the twisted triangle easier for you. And if you want a little bit more challenge, having your legs more like a tightrope position. So bring the right foot forward, let the pinky toe edge touch the chair. That's a little awareness piece for balance. And then take the left foot back. Both toes are pointing forward. Take your hands on your waist, bending at the hip joint, keeping your spine nice and long. Suck the left leg into your body. Push the left buttock back as you flex forward in your hips. You could take your hand diagonally. Left hand comes diagonally across the chair, or it could be on the seat of the chair. Or you could go even lower and bring your hand on the block. So do what feels appropriate for you. Whatever you're doing, you're pushing away to lengthen your spine and rotate your spine forward. Open up the shoulder, open up the heart. Press the back big toe edge into the floor. See if you could lengthen your heart, push your heart down towards the ground and lengthen. So slight back bend in that thoracic spine. Pushing away from the chair and then rotating. Suck the left leg into the socket and push the right leg into the socket. Push the right buttock back to deepen the rotational force in the pelvis. Here getting the hip, the side hip, getting the lumbar spine. So a lot of hip and spine stimulation in the twisted triangle. Take one more breath. To come out, you bend the front knee, keep your spine long, keep your head lifted, and de-rotate your body and come up. Go to the other side. Bring in the block if you're using the block, or the chair, just the chair. Whatever it is, your practice. So now we bring the left foot forward, touching the chair, right foot back, toes are pointing forward. Look forward, hands are on your hips or on your waist. And then suck that left leg into the socket, left tushy is back. When you load down into your hips, bending forward in the hips. Hand on the back of the chair so that the right hand comes diagonally across, or the seat of the chair, pushing down, lengthening your spine and rotating forward. So now you draw the left leg in the socket, push the left tushy back, push away from the right pinky toe edge, lengthen your spine, press your heart forward. You may feel this all the way down in the right foot, the right calf. This is a rotational wringing out of the body muscles, so increases range of motion, the joints flexibility. There's a balance component, a strength component. Push away, lengthen, and rotate. Take one more breath. To come out, you bend the front knee, keep your spine nice and long. Bring yourself forward, up, out, and let's find mountain again to catch the breath. Lift your toes, hands down alongside your body. If you're able to close your eyes, if you feel secure in your balance, you could close your eyes and feel and notice, or minimize your gaze looking straight ahead, maybe 10 feet in front of you if you want your eyes open or need them open. Hands down alongside your body, pushing the feet into the floor, the top thighs back, tailbone down, heart lifted, chin parallel towards the ground. Take one more breath. And then if your eyes are closed, open them. We're gonna come down to a seated position and then onto the ground to do more postures. So clear your space and then get some other props. We're gonna need the strap and the blanket. So grab your props, put them a little closer. We're gonna come down and do the twists. So take your blanket and fold your blanket in two. Bring your blanket onto your mat. And I'd like to lower down in a squat position. So take your legs wide as you can, and then push your tushy back, bend your body forward. So the tushy goes back as you bend in your hip, you bend in your knee. Try not to let your knees go forward, but rather push your tushy back. Look forward, and then bring your hands onto the ground, and then bring one leg down and then the other. So we'll come into the seated twist. So you'll need your blanket and you'll need your blocks for this. The block. So bring the block to the left side. So behind you on the left side. And then bend the left leg. So bending the left leg, straightening the right leg. Hold on to the left leg with both hands and then hold on with just the right hand. Keep the right elbow lifted, spine is long. Take your left hand on the floor behind you or on the block. So you decide if you need a block or not. Keep that right arm lifted. Press the right leg down. Right arm lifted. Press the left leg down. Pull your heart towards your thigh and then exhale. And as you inhale, turn the lower ribs to the left, the middle rib cage to the left, and the upper rib cage. So try to turn the rib cage to the left. Push the right foot down, keep the right elbow lifted. Lower the shoulders from the ears, slide the shoulder blades towards each other, and then press and lift your heart, lengthen your spine. So rotation with a lengthened spine is what we want. No rotation with flexion in your spine. So keep that safe spinal space, lift that right arm, pull the left leg towards the heart, push the shoulders away from the ears, slide the shoulder blades towards each other, push away from the ground with the leg, push away with the hand. Deep breaths to your belly. Take one more breath. When you come out nice and tall, lengthen your body. Let's go to the other side. So move the block to the right if you're going to use the block, or you can use the ground. Bending the right leg, hold on to get nice and tall in your spine. Elbows are lifted. Take the right hand on the ground behind you. Hold on to the right leg with the left arm. Keep that left arm lifted, the left elbow. Press that left foot into the floor, left toes are towards you. Exhale. As you inhale, turn the lower ribs, middle ribs, and upper ribs to the right. Push the shoulders away from the ears, slide the shoulder blades towards each other. Lift your heart, lengthen your spine. Push your right foot into the floor, your left foot into the floor. Push your right hand into the floor, lift the left elbow. Lower the shoulders, slide the shoulder blades towards each other, and lift and lengthen your spine. Keep working when you're in the rotation. Keep working on that rotation. Pushing away and lengthening and rotating. Take one more breath. And then with length, unwind. So we're going to come into the seated bent leg twist. Now for those that have knee issues that you cannot bend your knees, you could actually stay here in this place, take one leg across and one knee across. And we're going to go into the rotation like that. So if you need to keep your legs straight, stay on the blanket here. If you're able to bend your knees, bring the blanket underneath the right buttock. So slide to the edge of the blanket. So only your right buttock is on the blanket. Then bend the right knee and bring the right heel underneath your left tushy. Take the left leg across. Arrange yourself so you have left buttock on the right heel and the right buttock is on the blanket. And then hold on to that left knee with the right hand. Lift and activate that elbow. Hand is on the floor behind you or the block. Push down to get tall, and then inhale into the twist. Lower rib cage, middle rib cage, upper rib cage. Press the shoulders away from the ears. Slide the shoulder blades forward. Lift and lengthen your spine. Push away from the floor. Lift your right elbow. Push your feet into the floor. Equal pressure on the left buttock that's pressing into the right heel and the right buttock pressing into the blanket. Lift that right elbow. Deep breaths. Lift the right elbow, press away from the ground, lower the shoulders, shoulder blades forward, lift, lengthen. Take one more breath. And then lift up and bring yourself out. We'll go to the other side. Now you move the blanket over so the left buttock is supported by the blanket. You bend the left leg so that the left heel comes underneath your right and your right leg goes over your left. So it's a twist, it's a bent knee. So we're twisting the bottom body. So now when we rotate the spine, we pull on the side of the pelvis. So we get a lot of hip stimulation here and spinal stimulation. Take your hand on the floor behind you or on the block. Hold on to the right knee with the left arm. Left elbow is active and lifted. Press the right buttock into the left heel and the right foot into the floor. Exhale. As you inhale, lower ribs, middle ribs, and upper ribs. Rotate into the rotation. Feel that. Press away from the floor. Lift that left elbow. Lower your shoulders from your ears. Slide the shoulder blades forward. And then lift your heart. Lengthen your spine as you rotate. Keep working. Lift the elbow, lower the shoulders. Press the shoulder blades forward to lift the heart. Press away from the floor. Pull the right knee closer to the heart. Take one more breath. And then nice and tall to unwind. Come to sit on the blanket with both buttocks. Bring the block in front of you and come into a wide stance. Let your body fall forward towards the front edge of the blanket, pelvis tilting forward, and you could use the block here to push away to keep your spine long. If you're able to go a little deeper in the stretch, a lot of adductor inner thigh stretching. It's the hips that bring you forward, maintaining the safe spinal space. You don't want to collapse that to try to bring your head closer to the ground. You want your whole body to go forward if you have that range of motion in your hips. Take one more breath. And then bring yourself nice and tall out of that. Take the block off to the side. So we'll come onto our belly to do locust posture. Now the thing with locust, we are doing a back bend, and the goal is to bend your spine to lift up against gravity and to try to push pressure at the back of the vertebra, pushing the bones into each other to create stimulation and strengthening the back muscles to hold up against gravity. So bring your blanket onto your mat, bring your knees back to your back edge, and then come forward. The gaze is forward. Walk your hands forward. Come down onto your elbows, and then bring your pelvis down onto the ground. Walk back if you need to support your pelvis on the blanket. Come into Sphinx here to get length in your spine. Push your elbows into the floor. Spread your hands. Toenails touch the floor, and then lengthen. Pull the rib cage away from the pelvis as you lower down, creating a lot of length in the middle body. Take your elbows out to the side, hands are on top of each other, walk the feet to touch, big toes touch. Lengthen the back neck and let your forehead touch your hands. Exhale. As you inhale, imagine you're pushing a marble away with your nose. Push your hands into the ground to bring yourself up and away from the ground. And then inhale to lower. Exhale to lower. Inhale to rise. Push a marble away. Close your eyes and feel the belly stretch. The front of the body is stretching and the back of the body is contracting. So warming up those back muscles. They should be nice and warm for the rest from the first part of the practice. One more. And then bring yourself back. Take your arms alongside your body. Forehead touches the ground. Toenails touch. Take your arms alongside your body. Exhale. As you inhale, push a marble away with your nose. Lift your head up. Peel your heart away from the ground. Lift your arms up. Palms are in towards each other. And then your legs, press them up towards the sky. Push your pubic bone into the ground to protect your low back, or you could squeeze your buttocks here. If you're able to clasp and keep your arms long and away from your torso, you could try to clasp. Reach long with your head, long with your legs. Close your eyes. Press the back of the spine into itself. Make a smiley shape, smiley face. Back bend. Try to push the back of the vertebra into each other. Deep breaths. Long body. Reach long with your legs, long with your hands, long with your head. And reach up towards the sky. Take one more breath. And then bring yourself down. Fold your hands. Let your forehead rest on the back of the hands. Take your legs wide. Bend your knees. Soles of the feet are up towards the sky. And then allow your legs to gently flop side to side, relaxing your low back. Keep your mouth closed. Breathe deep to your belly. Take one more breath. And then bring yourself back to center. Reach your arm, come onto your side, and then push yourself up to seated so you can take your blanket up to the top of the mat. Have your block and strap nearby so that we can grab them. So we're going to come down using the core, contracting the core. Tilt your pelvis back, roll through the lower spine, the tailbone, the sacrum, to the lumbar spine, and then all the way down. Arrange yourself so that your head is on the blanket, and then take the block and bring the block between your knees. We're going to do bridge with the block. Walk your feet closer. Your feet should be pointing forward and your feet should only be about 4 inches or the distance of the block. So put the block between your knees. And you're going to take the blanket away from the back of your head. Press your arms into the floor and your head to lift your rib cage up. Slide the shoulder blades towards each other. Keep your arms bent alongside your body. Lift your head, lengthen the back of the neck, tucking your chin towards your chest. Squeeze the block. Inhale. As you exhale, push your feet into the floor, squeeze the block, push your pelvis up towards the sky, bend your spine, and then press the arms into the floor. Feel the back of the body activate when you do that. Push the shoulder blades forward. Try to bend your spine as much as you can here. Close your eyes and feel this in your body. Squeeze your block. Squeeze the buttocks, squeeze the block. Press the arms in, bending the back of your spine. Deep breaths here in bridge. Push your feet into the floor. Try to unbend the hip joint, squeezing the block, pressing your arms in. Squeeze the block, squeeze the buttocks, press the hands into the floor. Take one more breath. When you come down, go down slowly. Start to push the vertebra towards the ground, one vertebra at a time. Come onto your tippy toes, squeeze your block. Try to press the spine down onto the ground before the pelvis touches. Really stretch the low back. Bring yourself down. Take the blanket back under your head, knees to chest, and rock side to side. So we're going to do the 2 leg stretches. The intention is to pull on the pelvis. So stretching the hamstring muscles and the adductors, pulling on the pelvic bone to create more flexibility for fracture reduction risk. We want to make sure that we have a lot of flexibility in our body. So if we do slip, trip, stumble, or fall, we have more range of motion in our muscles. We're not pulling on the bones to create a fracture. Take your left foot into the strap. Walk your hands up the strap. So walk your hands all the way up so your arms are straight. Hold on with the left hand with the left piece and the right hand with the right piece. Strengthening our hands while we're at it. Take your right leg straight or keep the knee bent. Push the right leg into the floor. Pull down on the strap. Feel the pressure in the left buttock all the way at the edge of the buttock where the round part is. Push the leg away and let's come into the posture, pulling the leg back behind you. Pull the leg back and push the leg away. Push the leg away, pull back, create as much tension as you can. Push your buttock to the ground. Feel the edge of the buttock. Try to feel that pulling on the pelvis with the strap in this position. Push the leg away, pull back. Push the leg away, pull back. Push the leg away, pull back. Take one more breath. And then release. Let's go right into the right foot. Bring the right foot up into the sky. Take the left leg down. Pull the strap down. Feel that pressure in the right buttock near the round part of the tushy. Push the leg away and pull back. Keep the leg straight so you pull on the pelvic bone. If you bend the knee, you're in the belly of the muscle. We want to pull on the tendons. Pull on the pelvis. Push the leg away, pull back. Push away, pull back. Keep active the whole time. Your arms are straight. Your hands are close to your feet. You're pushing away, pulling back. Push away, pull back. Take one more breath. And then release. Let's come into the wide leg stretch this, the Supta Padangusthasana 2 or big low toe 2. So keep your strap in your right leg. Take your hand on the strap, slide it down, elbow to the side. And then lengthen the leg out to the side. Keep it high and out to the side. Push the left leg down. Let your leg go. Keep that left thigh rooted down. Activate your core. Push that left tushy cheek down. Push into the arch part of the strap. Pull the leg up towards the wall behind you. The stretch now is on the adductors, the inner thigh muscles. Push into the arch. Push that left pelvic area down, the buttock area. Use the core, use the trunk stabilization muscles. Take one more breath. And then bring your leg up. Let's go to the left side. So now you bring the left foot in, you hold on to the strap in the left hand. If you'd like to straighten the right leg, you can. Take your left leg high and lengthen that left leg out to the side. Stabilize your pelvis. Keep your right buttock down. Activate your core. Push your buttocks down towards the ground. Left foot towards the wall behind you. Push into the arch part of the strap. Push the right buttock down. Left leg to the left. Take one more breath. And then bring yourself back to center. Take the strap off, draw the knees into the chest. So the final posture is Shavasana, corpse pose, posture of integration, to allow the internal environment to recalibrate to the new strength, the new space, and everything that was created in the practice today. So come into Shavasana. Take your legs long, arms are out to the side. Close your eyes. Deep breaths. Feel the lungs moving in the 6 ranges of motion. Feel the backward movement of the lungs. Breathe in and breathe back. Breathe to your side, waist, both sides. And feel the up and the down movement of your lungs with breath. And then finishing up your last breath. Start to bring movement into your body, wiggling your fingers and your toes. Start to move the ankles, the wrists, and bending the knees, bending the elbows. Draw one knee into the chest at a time and rock side to side. Come all the way onto your side. And then from here, push yourself up to a seated position. We'll close the practice with sound. We'll do the Om. So the Om is a blending of the Ah, Oo, So take your hands at your heart and open your mouth and make the Ah, Ah, Ah. And then close your mouth halfway as you exhale. Oh, oh, oh. And then close your lips all the way. So the Om sound is your sound on an exhale from an open mouth to a closed mouth. Close your eyes, press your hands to your heart, sit nice and tall. Exhale. Inhale deeply. Bring your hands to the forehead, bow forward. In gratitude, namaste. So practice these postures on the mat, maintain the safe spinal space, take that out into your life and focus on bending in the hip, doing something every day, because the more you demand from your muscles on a daily basis, the stronger they will be, and the stronger they are, the stronger the bones will be. Great for feet, for ankles, for fall and fracture prevention. Do your best, leave the rest. Every day do something, and that's how you stay strong and fracture proof. All right, so I think more of you know. I am thinking that maybe the email did not go out for today. So you could watch this recorded. That was a lot of great posture. Well, we actually did 13 postures because we did mountain a few times. So 12 poses versus osteoporosis. That's what we are focusing on, is being as strong and flexible. Great. Yeah, thanks, Kathy. All right. Thanks for being here. And I'll be off for a few weeks. I'll still send out some information though. All right. Thanks.